Hello, everybody. I am Dr. Renee Sunday. I want you to come in and like and share. And this session, let me make sure my volume is good. This session is AXA MD. And please like and share. I'm going to make sure let me see. Okay, let me turn my volume up just a little. And this is just a chat session. It's a lot going on in the world today. And a lot is going on that people are speculating. People don't know the right answer. And so I said, with my platform and the many things that I do, I'm in ministry. I'm a board certified anesthesiologist for 20 years. And I am award winning. I've been nominated twice as one of the top anesthesiologists in the world. And so I said, instead of people posting all the time, asking people that don't have I just be real, don't have the capacity to even answer the question. I said, well, I would do a live broadcast. So if you can ask your questions, some questions have been sent in privately, and I will entertain those. And it's just a time that we actually need to be together. We actually need to also be able to have patience with each other, because as you know, and I'm in the 50 group, that we have not experienced anything like this before. Even if you talk to people that was here during the syphilis and the polio experience, this is totally different, because we actually we're advised to stay in and do social distancing, the 6 feet apart. And so a lot of things are going on. The schools are not in. People are debating what's essential and what's not essential. Of course, people have to make a decision. That's in leadership. I have been in leadership for a long time, so I know, first of all, everybody is not going to be happy, number one. And everybody's going to have a different opinion. So we have to go with the rules of the land, and we have to govern ourselves accordingly. But as you come in, I'm going to have my phone. There's some questions that did come in, and so we will address those. But we're broadcasting live on Facebook, Periscope, YouTube, LinkedIn. And I'm missing one. What's the one I'm missing? But anyway, we're here live. So everyone, let's see. Let me go to the comments to make sure that I'm actually, a lot of people said a lot of things, that they are excited for the show. Dr. Stanley, Dr. Pam, Love Manny. But you guys, please like and share. I appreciate the comments. But we're going to actually get some, Ms. Carol O says, congratulations. Glad to see such a person as yourself. So we're going to actually chat. And I'm going to actually, Okay, so I think we have everything. And so we're going to get started with the questions that some people have sent in. And if you have any questions while we're here and you feel comfortable in sharing them openly, you can actually do that. Okay, let me see. Okay, wait a minute. One minute, you guys. There's something going on with the. Okay, let's see. All right, let's start the questions that came in, but I was trying to make sure you guys can hear me. Somebody type in that if you can hear me. I just want to make sure. Okay, I think I see. Okay, yeah. So we good. We good. Okay. Uh-huh. All right. So what we're gonna do, let me go. I want to make sure I have the right information here about the questions. I want to. Okay, someone sent the first question, someone sent in. They wanted to know, well, Dr. Sunday, this pandemic that we're going through, what should we be doing right now? Well, the main website that everyone needs to have on their phone, need to actually have available, is the cdc.gov. The cdc.gov is the cdc.org. Sorry, forgive me. .org. It has all the information if you're actually having problems with different symptoms, if you're having running nose, if you have an abdominal pain, if you having a fever or not, if you have whatever symptoms, and you go through the algorithm. What an algorithm means is you go through the different steps, and there you say yes or no if you're having those symptoms. Just like if you were in front of a doctor, just like you were in front of a nurse. These are things that you are experiencing right now. Okay. Then if by the algorithm that doctors and nurses have put in there, the specialists, the experts, they will suggest if you need to have a test or not, according to your zip code. Okay. So places that, for example, my zip code may be totally different from someone else's zip code that's in a whole nother state. You see what I'm saying? Okay. So keep that in mind. Keep that in mind. It depends on your state. It depends on your state. It depends on your zip code. So if you're having symptoms of running nose, you coughing up, if you have an abdominal pain, if you're having a fever or a low-grade fever, because the elderly, and you've seen many reports, but the elderly, what they're deeming as elderly is anyone over 60, 65. Now, in the medical field, that depends. It's different. I'm just being honest. Some people consider it 70, but with this what we have going on, they've kind of made it 60, 65. And if you have any what we call comorbidity or coexistent concerns. Now, I want to talk about that just a minute. What is that, Dr. Sunday? Well, first of all, the list that we usually run is diabetes, hypertension, coronary artery disease, when you have blockage in your heart, people that have autoimmune diseases, and depending on what severity it is, rheumatoid arthritis, sarcoidosis, lupus. Let me see if I can remember another one offhand. Graves' disease, meaning your thyroid. Anyone that has just limb concerns, where they have different difficulties in walking. That can be any of the dystrophies, muscular dystrophy. If anyone has cerebral palsy, let me see if I can think of some more on the top of my head. Of course, the big area, if anyone has cancer, have had a diagnosis of cancer, and it's all type of cancers. Okay, especially if you've had radiation surgery, or if you've actually had to do any kind of injections or pills you had to take for cancer. Those are the high risk, what they saying high risk that people are in concerns in regards of having problems or concerns with this outbreak. Okay, all right. So the next thing is people wanted to know, well, Dr. Sunday, why people are having trouble getting different supplies and stuff. Well, first of all, I used to be over a 30 operating room facility here in Georgia. And what we tend to do is we order enough supplies that actually it depends on what the drug is, what the medication is, what the supply is. Sometimes all of them have an expiration date, and it depending on what kind of storage space you have to actually have things available. So, for example, one medication the expiration date may be in 2 weeks. So that means you don't order a lot of that. That wouldn't be economical. It wouldn't make sense, and of course, it's not safe, right? So in regards of the gloves, the mask that we usually order how many cases we have. So what we have going on, especially in our brothers and sisters that having concern in what they deem is the hot areas of New York and California, we're doing, 100% more than we normally do. So we actually, the corporations that make these, and a lot of corporations have stepped up because they know the protocol. They know how to make these products. A lot of people are jumping up doing these different products, from hand sanitizer, from masks. But please, 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 are you doing it in a sanitized environment? Because when you're making the products, you may actually been exposed, or you may be a high risk person that's making these products. So think about what you're really doing. These corporations have rules and guidelines that they're actually doing to make the product safe. They have FDA guidelines, which, do you know what those are? A lot of times you don't know them unless you're in that industry. So be mindful that it has been reports that people actually have had problems with these made at home different products and services that people are creating. I'm not knocking people of getting, trying to make, the revenue or trying to help out, but make sure you contact the FDA, contact the government, and know what the regulations are, because a lot of people are sick because of the products and services that you are creating. Okay. And as you guys come in, please like and share the broadcast and share it with your friends, because a lot of information is going on out there. And this is the place to ask the questions, because a lot of times with misinformation, you end up doing the wrong thing. Now, if you have a private concern, you can always, as that banner is going across the bottom, a complimentary session with me, go to our website, which is reneesunday.com. So another question that had came up is, Dr. Sunday, what should we be doing in regards of going to the different restaurants? Well, we know all the restaurants, majority of them, all that I'm aware of, that's in my vicinity, you can only go through the drive-through. Okay, so just be mindful of that. Do what we're supposed to do. A lot of people are positive. A lot of people, as we know, are passing away and have died from this. And so the thing is, you can feel so good and you don't have any symptoms, and you may be a carrier. So let's be careful. Let's just make sure that we're actually doing things to help our brothers and sisters. Okay. Because it's not about you. I know the different rules that come and they change every day. But keep being mindful that we actually have to do this so we'll be safe. Now, let me go to the next question. The next question that came in was, and if you have any questions, let me see. Make sure I'm not. If you have any questions, you can type them at the bottom there. Another question that we had was, how long this gonna last? Well, we don't know. I think that we need to just govern ourselves accordingly, because we don't want to continue. The problem is in certain areas, that especially the hot spot, but in all areas, that we're doing what we want to do and we're infecting other people. That's what's creating the problem. So that's what one question was. Be safe. Do what the guidelines are. The CDC is the main website that should tell you what you need to do and not do. Okay. Now, the next question was, let me see. Oh, this was one question that was sent in. How do you feel being on the front line? Well, you know, I was created for this. I was created. I'm on the front line in ministry. I'm in the front line in business. I'm in the front line in media. I'm in the front line in the healthcare industry. So you know what I do? I pray, I prepare, I position myself. And if you didn't get those 5 P's from the last broadcast, I'll link it below after this broadcast. So one of my team actually link it below so that you can get it. But the people on Periscope, hey, on Periscope, make sure you give me some hearts and share. Facebook is hanging in there with us. So we have to pray for the people in the healthcare industry. They really are sacrificing. Well, we've been sacrificing all along, but it has never, come to the line. This is what we normally do, take care of our patients. This is what we normally do, the standard of care. This is what we normally do. But pray for them because we've been, I always used to be very careful what I did around at my home in regards of, the scrubs I would wear, the shoes I would wear. But we just got to be mindful. Things that we're doing that we're supposed to be doing, you're supposed to always, guess what? Wash your hand. That's normal, right? Right. So just be mindful of what we're doing. Pray for the people in the healthcare industry because they're making a major sacrifice to help us. And I'm saying us because, the reason I have pink on today, I have my mom's t-shirt on because I can't, some people can't go to visit their family. All of us, right? I for sure can't visit my family because my family is elderly and I'm in the limelight every day. And so I can't risk of putting them in danger. Okay. Right. Okay. So always think about other people, not always yourself. Okay. So actually we have Denise looking in, Marsha Young, Denise, their fellow healthcare providers, Anthony Dobson, Bishop Howard is here as well. But we just thank you guys for coming in. I'm gonna answer a couple more questions. And if you have any questions, you want to do it privately, you go to our website, reneesunday.com. People say, you hear a lot of different medications that's coming out saying that they're going to try this and try that. Well, a lot of the medications that they are trying are medications that have been in the medical industry for a while. We have never tackled this to this magnitude before. So we commend, the medical field of the different scientists of trying the medication that they think that's going to help our patients, right? The great thing that we need to do is stay inside. That's what we need to do. That's what we need to do and continue to pray for one another. That's what we need to do, right? Okay, so the next thing was, another question is about the nonprofit organization. Well, from my understanding, a lot of the nonprofits are, especially the shelters, are at maxed capacity. If you have any access of helping people out with that, you can contact your local, United Way or one of the major nonprofit organizations. So you see how you can help out. Instead of always complaining, won't we see how we can help our brothers and sisters? Have you checked on the elderly that's next door to you? Have you checked on the person across the street from you? Have you checked on your own family? So those are things that we need to make sure we do instead of always complaining about this, that, and that. And I want to continue that conversation about the different medications. We've heard that they're working on a vaccine, but vaccines takes a little bit more time to actually study it because you can't really put a vaccine, to administer to people without actually going through the different testing that the Federal Drug Association has for us to do. All right, welcome. And so we have to just make sure we stay inside. We need to make sure that we're washing our hands. We have our different sanitizers, our different Lysol, whatever product you're using. If you made some for yourself, just if you're selling it, just be mindful that you're making sure that it's sterile. That means that you actually, when you created it, you went by the Federal Drug Association in regards of how to create products for mass production. Because if you're doing it without gloves on, that's not appropriate. If you're doing it without making sure you clean down your area with sanitizer, that's not appropriate. Okay. Well, let's continue to pray for our brothers and sisters all over this land and country. be mindful of what's coming out every day, and we need to govern ourselves accordingly. That's what we need to do. Okay, let me see. One last question came in. Oh, now this is interesting. What should we tell people right now that's in nursing school? What we should tell people right now that if they're in a healthcare profession? We actually do have a self-care health professional Facebook group that we started, and the name of it is, the name of the group is, let me type it in here, self-care health professionals. So just Google that, and we'll let you in that group, because we're giving tips and strategies that you can actually apply to your life right now. I've actually coined 2 books while this season's been going on, and it's 75 things that a doctor should do to have self-care in their life, and also 75 things that a nurse should be doing right now to relieve their stress. And we actually have those available for pre-order if you're interested in that. Welcome, Mr. Davis. Make sure you guys like and share the broadcast. But so don't forget that Facebook group to go into self-care healthcare professionals if you're a healthcare provider. The other last thing, I want to continue that conversation where they say, I think I always wanted to be in the healthcare industry because I always wanted to be part of God's plan of helping people, be better. And I will continue to do that. Our motto is to make sure we do self-care. And that's what all the healthcare professionals are doing. So keep them in prayer, but make sure you guys just stay inside. I mean, if you got to go to the store or something, go and just go back. Just do the regulation. That's what's happening. Unfortunately, a lot of people just doing what they want to do. And just think about the person that you don't want to hurt anybody else. I know I don't. That's my mission in life, never to hurt anybody else. I'm here to build people, edify, and exhort, and to help people in life. And that's what we all should take that charge. That, a lot of procedures have been canceled, but they're doing it to actually do your, to be safe. Now, I think Yolanda just said regular doctor visits will follow. Yes. A lot. I had, I had an eye appointment, and what other appointment I had? Oh, I was doing physical therapy actually for my shoulder, and my arm. And those have been postponed, but that's okay, because I know the exercises. While we on YouTube, you can actually find exercises to help you. Yeah, you know what I'm saying? So we actually, in the doctor's appointment, a lot of the doctors are actually doing telehealth. So just like you see me now, contact your doctor, and your doctor can talk to you and give you some advice via the computer. You see what I'm saying? So what we need to do right now in this season is support each other. What are you working on in your business? Right now in my business, oh my Lord, I think I've written 3 books, and I've actually created 2 journals, and I'm about to launch a membership group. I actually plan out my women's conference for next March. I actually have a conference that's still going to be this fall. So we still busy doing things that we can actually empower someone else. Now, let me make sure let me see. I'm trying to make sure I didn't miss any other questions. But the key is to make sure that we're doing what we're supposed to be doing. Okay. Now, if you have any private questions about your business, about this will be a great time to start a podcast. And we'll be having a master class coming up about that. I'll send the information to you about that. But I actually have a checklist and we'll put that link in if you want to get some information. This will be a great time to start a radio show. Good time to start a magazine. A great time to start a membership or any kind of online business. This is your time. Okay, another question is coming in with precautions. I just went to an establishment to pick up my prescriptions. And I feel for a lot of things, if you go into any restaurant, any store, it's going to take time. It's something that would take you normally 10 minutes. It actually is taking you 30 to 40 minutes to an hour. if you go to the different grocery stores or the different department stores and picking up your medication. They actually are allowing you to do a 90-day supply of your medication if they apply, and then you have to contact your pharmacist to find out which, if you apply for that. The other precautions is wash your hand. I mean, regular soap actually would do it. I know they say a lot of the hand sanitizer is gone. The the Lysol, and what's the other one? Pine Sol and all those things. But just wash your hand. We got different dishwasher liquid. Just wash. That's what we're supposed to be doing anyway. It's not like that has all of a sudden just came up. The best thing to do is to really stay inside. The hot spots we're seeing in different counties. It started off that the risk factors of people were overseas that had international travel, but now we're seeing people that actually was that especially the healthcare profession, getting it from people that just was just walking around doing their normal daily activities. Okay, and it's affecting all of us. The churches can't meet, right? And the different you can't, like we said earlier, you can't go to your doctor's appointment. You can't go in and sit down at a restaurant. One person put on Facebook that they they haven't been to a fast food restaurant and since this was going on, but they've been cooking every day. I've been cooking every day. So the thing is, we have to do is make sure, and especially, let me say this with our kids being at home, make sure we're talking to our kids and let them know what's going on, and not always talk about something that's negative. This is a good time to do a card game. This is a good time to actually tell a story of how, of your family history and your legacy, of what you want your legacy that you grinding on. Let your kids know what that's all about. So a lot of things can be done right now. And I know I think I've written up 5 or 6 notebooks, okay, on different things. Okay. So if you want to actually get some information, we can do a free complimentary session on how you want to take your business to the next level, how to actually put it online, actually how to have a podcast, how to launch your own, how to launch your own magazine. And we actually releasing our magazine today. Just thought about that. And it's actually Happy Doctor's Day, right? Yeah. So we're happy to be a doctor. Yeah, yes. And Periscope is coming in. The young lady saying, all the internet has been having glitches. So you guys, if it's going in and out, all people's internet's been slow because everybody's at home trying to do, they work on home. And so it's exhausting. And especially Facebook's been slowing down, all the Periscope's been slowing down. So, okay, let's see. I'm trying to see that I get all the questions that were sent to me. I think that's it. But I really want to encourage you right now in this season, open up your creativity. Actually write that book that you're supposed to have been writing 10 years ago, write that play that you're supposed to have been doing 10 years ago, and be grateful. We need to be grateful because guess what? We do have electricity. Amen. We do have, if it's 90 degrees, I guess, in Florida, we have an air conditioner. Here in Atlanta, I think it's almost 80. Woo. But we have electricity. We actually can go to the store and get some products and services. Right? So let's think at the good side of things and make sure you check on your loved ones. Make sure you check on your elderly that's in your neighborhood. Let's just be all about our brothers and sisters keeper. That's just what I want to say. But anyway, if you inbox me, if you have any questions, let me see what else I was going to say. You can go to our website if you want a complimentary session and we can talk about how moving to the next level in your business, your purpose. And if you want prayer, just inbox us. If it's a private prayer request, just inbox us about that prayer. Okay. But I do want you to remember that you do have a calling. You do have a reason you're born and you're not a mistake. No matter what you think is going on right now, you're not a mistake. You're not a mistake. This too shall pass. Okay. Now join us. We still having our Dr. Renee Sunday show. It's every Monday and Thursday at 5:30 p.m. Eastern Standard Time. So watch out for that and that information if you want to be a guest on there. This is a great time to be on other people's podcasts, other people's radio shows, other people's TV show, because what they're doing, they're interviewing people via Skype. So let's actually be grateful where we are. Let's be about our brothers and sisters keeper. And if I can help you with anything, don't hesitate to contact me. Okay. I love you. I love you. And remember, this too shall pass. And I'm so excited to be where I am because I do have the 20-year experience of being a healthcare professional. And I don't take that for granted. I'm very humbled to be where I am. I'm very humbled to be where I am in my business. But think about, write down what you're grateful for, because I know there's plenty of things that you're grateful for. And let's continue to actually lift up our brothers and sisters. Okay. Now, hey, Bishop, how you doing? Yes. So if you guys, as we get off here, any last questions, don't hesitate to inbox me if it's a private conversation. We can do that. I am doing counseling sessions as well. And if it's something that's out of my scope, I'm going to be the first one to find you somebody, okay? Because I'm not going to take on what I can't have an expertise in, okay? Because this is actually a grief. A lot of people, it's pretty much you going through the grieving process. That's what's going on. I mean, some people have lost a loved one, but any grieving situation is a difficult situation. So it may be losing your job, waiting on the stimulus, you can't go outside. You're nervous because you can't find any masks. All that we need to take care of. Take this opportunity to be creative. Take this opportunity to invest in somebody else's business as you invest in your own business. I am Dr. Renee Sunday. I'm known as the platform builder, but I wear a lot of hats. So I want to come to you today as a board certified anesthesiologist for 20 years. Okay. So I want you to know that this too will pass, but please stay inside. Please take care. And please pray for your brothers and sisters. Talk to you later. Bye-bye.